Hi, good afternoon, everybody. Thank you for joining us. We're going to be starting soon. We're just going to wait for a couple more people to join in. But welcome. Thank you for being here with us. Hi, thank you for joining. We're going to wait a couple more minutes just to make sure that everybody signed in. But thank you so much for being here. Such a pleasure to be with you and be with an amazing nursing department at Cal State Fullerton. We're really excited for this presentation. We're going to be starting shortly. All right, we're gonna get started. So my name is Eloisa Amador Romero. I'm an urgent recruitment counselor at Cal State Fullerton. And I'll be your host today. And we have the pleasure and such an honor to be with amazing people from the nursing department. They're gonna be sharing their experiences and also their requirements. This presentation is for high school students applying to the nursing program, direct entry into the nursing program at Cal State Fullerton. Just quick reminders, we do have a live and recorded webinars throughout the whole fall semester. So make sure you continue to, continue to log in, see the previous webinars that we have already done. We're gonna be having a webinar in Spanish this coming Saturday about Cal State Fullerton and the higher education system. So please continue watching those and registering for those webinars. We also wanted to give you a little bit more opportunities that we still have some services on campus, virtually, that we're still offering. So in the next slide, you will see that we do have a campus tours that you can see from the comfort of your home. And I know that I mentioned that this is only for freshmen, incoming freshman students, but we do want to create services for transfer students. So we do have a transfer center. We can be more than happy to help you with the information that you have. We also have a Q&A on the bottom, so feel free to ask any questions that might come up. And I'm gonna transition over to our nursing department. Thank you so much for being here.
Thank you so much, Eloisa. My name is Kate Bahan, and I am welcoming you to this webinar about the School of Nursing at Cal State Fullerton. A little bit about me. I am the BSN program coordinator, and I am a multi-time CSUF grad, so I'm a diehard Titan. And then we have Michelle. Do you want to introduce yourself?
Hi everyone, my name is Michelle Schwartz and I am the advisor for our nursing students here at Cal State Fullerton. Welcome.
Beautiful. So we're going to start off with a quick Zoom poll. So I'm going to launch my poll and feel free to answer. Do you love science, biology, how the body works? Is this a yes? Is this a no? Maybe. I got polls coming in. Oh, you guys are fast. Good. We're right at about 90%. And it looks like 87% of you say, yes, that's definitely me. And only a tiny bit of you said science is the worst. I'm going to share my results. Beautiful job. And then a couple that are still not finding out. Well, science is pretty important when it comes to nursing. So we'll step into what does a nurse do, the role of the nurse, and common places where you'll find a nurse. So I currently work in emergencies still as well. And some of the things that I'm commonly doing, assessing vitals, assessing my patients, collecting information and health history. I do tasks like starting IVs, drawing blood, EKGs, those things. I calculate meds and administer them, both oral and IV and shots, the whole gamut. I educate the patients and the families, and I coordinate as part of that medical team. Now, common places where you'll see a nurse, where you will find nurses, hospitals. Most of you are well aware that nurses are in that hospital setting, but we're also in clinics, assisted living facilities, military bases, home health, where the nurses come to you and provide nursing care in your home, prisons, and even schools. Now, I have a second question. Don't worry, I only have 3. But for my second poll question, can you stay on your feet for a 12-hour shift? Yes, no, or only at Disneyland? Beautiful job. Polls are coming in. All right. The bulk of you, I've got more than 80% that says, yes, I can stand on my feet for 12 hours. So my typical shifts are 12 and a half hours, and that is the norm in nursing, especially in that hospital setting. So having that resilience and tenacity and also knowing that expectation, that's definitely an easy part in hospital nursing. So as far as paths into healthcare, there are multiple paths into healthcare. So I wanted to kind of touch on other paths as well to help clarify where nursing fits in. So you can actually go get a lot of education and be a medical doctor or a DO or MD. These are individuals who lead the healthcare team. They tend to be more diagnostic, where they're diagnosing the issues and ordering labs and tests and kind of overseeing the care as one of the leaders of the medical team. You also have physician's assistants or PAs, and they work as part of that team as well, and they are under the supervision of the MD. They do have their own licensure, but the MD supervises, like when they write prescriptions and do stitches and those things, the MD is also overseeing. And then there's the registered nurse or the nurse. Nurses are integral in the patient care. You have a lot of direct patient care time as a nurse, especially in the hospital setting or home health, where you may see the MD for a brief moment, and the rest of the day, it's all nurses. When I end my 12-hour shift, I give report to a new nurse who then takes over your care. So you can get further education as an RN and get certifications and specialization, like as an NP or a CRNA who works as part of the anesthesia team, or a DNP. And NPs can work autonomously and more autonomously than that PA. They can have their own clinics, and that varies by state, but there are a few differences as far as those different paths into the healthcare setting. And my final poll, I'm going to, oh, did I stop? Number 3, can you deal with bodily fluids? Another integral part of nursing. Are you grossed out by the gory? And you guys, all right, you're very fast. So I've got almost 90% of you. This is a more split poll here. Beautiful. Okay. I'm going to show you my results. 72% said, bring it on, bring on the gore. And about 30% said, maybe not. No worries. So nursing, you definitely are in the nitty gritty. I want to take a moment to pause because I'm about to hand it off to our lovely Michelle Schwartz in a moment to see if anyone has questions specifically about being a nurse. She's going to touch on nursing at Cal State Fullerton, but the role of the nurse and those things.
So we do have some questions in the chat. A couple about being nurse practitioner. Besides autonomy, what are some differences between a PA and an NP?
This is an excellent question. And in the state of California, there is a lot of overlap with what a PA does and what an NP does. Typically, you'll see NPs that have specialization in a field. So you will be an NP that works just with geriatrics, or an NP that works peds, and you can work in a hospital setting as an NP, as an independent provider, where you are a colleague with the MD in that same field. And the PAs tend to work as with their own license, but in conjunction with the MD. So they will go in and they will fill prescriptions that the MD would have ordered, and the MD has to ensure that those are correct. The NPs are under their own license without that MD oversight. But it is a little bit gray in the hospital setting as far as the tasks that you can do as an NP versus a PA.
And we have one more question for you, Kate. What personally inspired you to become a nurse?
Um, so my family is all, the bulk of my family does some variation of healthcare. I have a father and a brother who are doctors, and another brother who is nursing informatics. And so I loved the sciences. I loved the mystery of the body, and I liked the capacity to have a bigger impact. I wanted to be able to use my critical thinking to then make a difference in an arena where I'm with the patients most of the time. So even though I teach full-time at Cal State Fullerton, I still have that bedside feel because it's so valuable to me.
And the last couple here, we have a couple questions about how to become a neonatal nurse, which I know is very specific. And then is there a difference between a neonatal nurse and a NICU nurse, or is that the same thing?
So to be typically when you graduate from nursing, then you will apply. You'll be applying everywhere, right? Because you'll want to get exactly where you want to be. If you want to work with teeny babies, neonatal, newly born, then you're going to try to get at least in a peds rotation. Oftentimes you'll see that pediatrics might have a new grad program where a brand new nurse will be sort of mentored through as they're learning everything. And then once you have more experience, typically a year, then you can get into the more critical, where you'd be like neonate, a newly born, or the very, very tiny. There are a few hospitals around that do have neonate or NICU new grad programs where they will take you as a brand new RN and train you as in the NICU itself. The NICU is the neonate ICU, and so usually they're used interchangeably because the nurses who are working with a newborn doesn't mean necessarily that they need to be in the NICU, but usually they're used interchangeably. If you're neonate, then you are in the NICU taking care of the sick new babies. Does that make sense?
Wonderful, thank you. And we're going to carry on with the next part of the presentation, but we will answer these questions either through the chat or verbally as well. Thank you for all of your questions. So again, my name is Michelle. I'm the advisor here in the School of Nursing. Something I want to touch on for nursing in general education here in California is impaction. I'm sure many of you have heard this word, impacted or impaction. And essentially what this means is that we just don't have enough space for the number of students who are applying to get into nursing school. We just don't have the space. So all pre-licensure nursing programs in the state of California are impacted. And pre-licensure meaning you get your license at the end of the program. So we're talking about an associate's degree in nursing or a bachelor's of science in nursing. And impacted, it doesn't mean impossible. I don't want to discourage anyone here. It's commendable that you do want to become a nurse. All it means is that it's going to be a little bit more difficult than a program that is not impacted. Instead of applying at maybe 2 or 3 nursing programs, we would encourage a student to apply at least 10 minimum nursing programs due to that impaction. Another common question we get is, I've heard there's a nursing shortage, so why do you only admit 40 students? And yes, we do admit just 40 students. And the reason for that, there's a couple reasons. The first reason is that the Board of Registered Nursing, which is who regulates us, the BRN, they have program size restrictions. We can only meet the needs of some students because we have hospital space, classroom space, and faculty. And we do not want to overwhelm the hospitals or overwhelm the classrooms or overwhelm the faculty or the students. Additionally, those hospitals where we do have our clinical rotations, they are only accepting of a certain number of students because they are serving many different schools. And of course, the faculty to student ratio. We want our students to have a wonderful experience. Nursing is very intense, so we want you to be able to have that one-on-one time with your faculty and again, not be overwhelmed with too many other students. Something else to note about the clinical rotation sizing is that if you think about being in the hospital, which is already usually not the most pleasant reason, usually, unless you're maybe having a baby, you wouldn't want, dozens of students at your bedside, along with the nurse and maybe the doctor. probably want less students. And so this is another reason, is that we want to be respectful of the patients as well. Next slide. So once you graduate from Cal State Fullerton with your Bachelor's of Science in Nursing, here's what that looks like. Once you graduate, you do sit for the state licensing exam to become an RN. That exam is called the NCLEX. So here at Cal State Fullerton, we provide you with the degree, the Bachelor's of Science in Nursing. We do not provide you with the license. So once you graduate, you still have to pass that licensing exam, okay, which comes from the state of California. Once you pass that exam, you are an RN, a nurse here in California. You can then go on to get other certifications, such as a public health nurse certification. You can enter a hospital new grad program. They have a lot of programs tailored to newly graduated nurses. Some of our students also work in clinics, nursing homes, doctor's offices, all of these other areas that Dr. Behan mentioned earlier. And something else I wanted to touch on is that a lot of our students go on to gain a specialty. So the BSN is very unique. I know you may have an older sibling in college or know someone who's gone to college, and maybe they were a certain major with an emphasis, or let's say a communications major with a specialization in something, in journalism, for example. This is not how nursing works. To be a nurse, you have to know a little bit of everything so that when you do graduate, you can pass that licensing exam and you can go work in really any area. It's not until after you get your Bachelor's of Science in Nursing that you gain a nursing specialty. You can do this by working in that area. So for our attendees here who are interested in working with mothers and babies, you would work in a labor and delivery unit, and over your years of working there, you become a specialist in that area. The other way to become a specialist in a certain area of nursing is to get a master's degree in that area, or of course, a doctorate degree. You can definitely further your education in different specialties, and you can definitely change specialties as well. It's kind of the beauty of nursing, is that you can have this one career that can go off in many different ways. You can work part-time or full-time or per diem. If you are done in labor and delivery, you can then go work in GI. There's a lot of different areas and a lot of different specialties. In fact, there are over 100 specialties within nursing.
And can we have a couple questions then, Michelle? Is that okay?
Yes, let me look here. Or do you want to read them to
I'll do it.
Q&A?
Sure.
Thank you.
Isabel asks, what is your pass rate for NCLEX?
Great question. So our most recent pass rate for the NCLEX of this last year was 100%. So most of our students do pass. The pass rates are based on the first time they've taken the NCLEX. If you do not pass the first time, you can take it again. A great website to visit, if you haven't already, is the Board of Registered Nursing website. It's rn.ca.gov, or you could just Google California BRN. They list the pass rates of every single nursing program in the state of California for the last 5 years.
And another question is, CSUF needs a supplemental nursing application. Is this correct?
This is not correct for our freshman program, and we're going to talk more about the application on the next couple of slides.
What does the situation for nursing look like this year with COVID? Anything different than it would usually be?
A great question. Yes, our nurses are still attending their clinical rotations in the hospital with, of course, some modifications due to COVID and, of course, for everyone's safety. But we are having our lecture classes online. They would normally be in person. The goal is for them to be in person once again, once we are all safe. But as of now, our professors are teaching virtually through Zoom, and our students are learning virtually through Zoom.
Beautiful. Thank you.
All right. So, of course, what we're here talking about today is our direct entry freshman program. This program is for students coming directly out of high school. So that is the main program we're going to talk about. But I do just want to note that we have other options for nursing if you are not admitted to this direct entry program. We have a pathway for current Cal State Fullerton students. I'll touch on that a little bit towards the end of the presentation. And we do have a pathway for those who obtain their associate's degree in nursing, or ADN. We have then a transfer pathway. So if you're familiar with the concept of a transfer student, it's a student who goes to a community college for a year or two, sometimes 3, and then they transfer to a Cal State or a UC or a private school. So we have this kind of program specifically for nursing students. And I'll talk more about it on the next couple slides as well. All right, so the main reason we're here today is this first year program. So we do have some general requirements for the program: completing your A through G in high school. That means, of course, graduating or obtaining your GED, completing the SAT or ACT exam, which we are going to talk about the changes to that due to COVID. Of course, there is the Cal State Apply application, which any student must complete in order to attend a Cal State. And you must have a social security number or an individual taxpayer identification number in order to be licensed in California. These are not requirements for admission to the Cal State. These are requirements for licensure as a nurse in California. And as I mentioned, we receive a lot of applications. The program is impacted. So we do receive usually about 4,000 to 5,000 applications every year. And we do admit 40 students to this particular program, this pathway. So let's talk about some changes due to COVID. We are still looking for your A through G courses, but we are no longer requiring the SAT or ACT exam. We won't consider it as well. So even if you did take the exam, if you are applying for nursing at Cal State Fullerton, there is no need to send in your SAT or ACT score. We are only going to be using GPA instead of the eligibility index, which is normally calculated using your exam scores. The Cal State Apply application is open now. The deadline has been extended to December 4th. It is normally November 30th. And you'll notice in the Cal State Apply application, when you do select the nursing major, that a 4th quadrant will be there that is specifically for nursing. The first 3 quadrants are general to Cal State Fullerton. That 4th one is nursing specific. In that 4th quadrant, you're going to learn all of the requirements for the letters of recommendation, which has a deadline of December 11th. You're going to learn more about the essay. The essay prompt is in there. And you're also going to report your GPA every year for freshman year, for sophomore year, and for junior year. And the reason we capture these GPA specifically is because we do a grade trend calculation. Because we can't look at your SAT or ACT score, and we don't want to only look at your GPA, we are also going to be looking at grade trends. So did your GPA rise from the time you were a freshman to a junior, for example? And of course, nursing is very, very specific. We are in this holistic admissions process. So we know that your GPA does not define you, nor do test scores or grade trends. That's why we collect the letter of recommendation, the essay, and the last step is the top applicants will be invited to interview. We do host the interviews in an online platform, and they will be hosted in the spring semester, in early spring. And if you are moving forward in the application process, every communication will be done via email. Okay.
And I do have a couple questions.
Yes.
Are you going to look at our senior year grades, excuse me?
Great question. Specifically for nursing, we are going to look at your cumulative GPA that you enter into the grade area of your application, but we are not going to have you be reporting your senior year GPA since, of course, you are in progress with that year.
Love it. Now then I have another question. After the 40 are admitted, is there a waiting list for the remaining?
Great question. We do keep a wait list, so we will usually admit a little bit more than 40 students, knowing that some students do not accept admission. Once we hit that goal of 40, we will no longer be using that wait list. So if, let's say, we offered admission but only 30 students accepted, we will pull 10 from that wait list. If you are, I do want to note that if you are not admitted to nursing, there are other options at Cal State Fullerton as well, and the admissions office will keep you updated on that.
And that was another question, is if we're not accepted into the program, will we still be able to attend Fullerton?
Yes. So how it works for nursing, because nursing is so impacted, is that Cal State Fullerton will review you for nursing. And once we've kind of come to our final top applicants, the other applicants who are still well qualified to attend Cal State Fullerton will generally be offered admission to undeclared, which just means not a particular major yet, or you can select another major that you'd want to be going into at Cal State Fullerton.
Now, can our letter of recommendation be from a teacher that we had in the previous year?
Yes, it can. I highly encourage you to go either into your application if you've already started one, or on our website where we go into much greater detail about who can do your letter of recommendation and how that is submitted. This is not a traditional letter that someone would write you and mail to us. It is a different type of form. So please do go on our website. The link for our website will be on the next couple slides as well. But I encourage you go on our website, or those instructions are within that fourth quadrant of the application to make sure you're doing the correct letter of recommendation.
Thank you.
Right, so I want to talk about really quick those other options that we had for nursing. For the, we do receive thousands of students who will unfortunately not be admitted to our direct entry program. But as we sort of touched on, you can come to Cal State Fullerton, as undeclared or in another major. You can still complete general education and nursing prerequisite courses and apply to our CSUF student pathway program. That does have very limited admission. Again, more information on that is on our website. The other option is to attend a community college. You can complete, again, your general education there and your prerequisites, and then transfer to a Bachelor's of Science in Nursing program, just like a transfer student. The other option is completing general education and prerequisite courses at a community college and obtaining an associate's degree in nursing, which I've touched on a couple of times at community college. For the students who do have an associate's degree in nursing, they can sit for their licensing exam after their ADN. They can transfer to Cal State Fullerton by meeting the transfer requirements, applying to the nursing major. We do, in that program, admit students in fall and in spring, so twice a year. And that program is not impacted because it is not a pre-licensure program. That program is also offered online and face-to-face, so a student can pick which format they prefer. Of course, I want to note that right now, everything is online due to COVID. So again, this is our website. I definitely encourage you, if you haven't been, to check it out. It is very comprehensive. We have so many little details there about our program. The website works with a left-hand navigation, which does work best on a computer rather than a mobile device. I will preface it with that. And we have everything that you'll need there, all the way down to the FAQs and specifics. If your question can't be answered on the website or couldn't be answered today, you can also email me. So if you are interested in the freshman, that direct entry program, the email is just bsn@fullerton.edu. And if you're interested in learning more about the other pathways we talked about, then you're going to just email us at nursing@fullerton.edu. And I'm going to leave this page up so that you have that information for you. And I am going to start looking into the Q&A.
I had a good one about prerequisite courses required for nursing program.
Yes, so with the freshman direct entry program, this program does not have prerequisites. It is a direct entry program, meaning you apply just like we talked about on these last couple slides. If you are admitted, you are a nursing student. There is no second nursing application. It is direct entry, which is definitely a benefit. If you've done your research, you may find that direct entry programs are not very common here in California. Us, San Diego State, are two of the more common ones that we have, at least here in the Cal State system in Southern California. So you are directly admitted. In your first year, what we're going to do is we're going to have you take traditional courses you need before starting nursing, which are commonly called prerequisite courses. And so these courses are going to be things like human anatomy, human physiology, microbiology, chemistry, psychology, writing courses, all of these courses that are going to help you do well once you start the nursing classes.
Thank you. Now, do you look weighted GPAs in the second semester?
Great question. We use the GPA that the Cal State in general uses, and the Cal State does use a weighted GPA. So we will look at your weighted GPA. Essentially what we're looking for is what is reported on your high school transcript. And I do see a question that I want to address while I'm on GPA was, what was the average GPA for students accepted last year? That's a great question. Last year, COVID was not impacting us at this time, so we did not actually look at individual GPAs. What we did was we looked at something called eligibility index, which was a mix of your GPA and your ACT or SAT score. So we based everything on eligibility index, not on GPA. So I do not have an average GPA from last year. In preparation of this presentation, knowing we are going to be using GPA and not eligibility index for this year, I did look up some of the GPAs of our top candidates last year. And I will say that we're going to be looking at all applicants this year, but last year a competitive GPA would have been a 3.33 and above. Of course, this is all dependent on who applies. That was last year's pool for those GPAs. This year, it all depends on who applies, which will determine what kind of GPA will be considered competitive. So I'm going to address some of the other questions that I see here. Tatiana asks, what pathway can be taken as an entry-level freshman in nursing? Do students have the option to pursue the major without being in the program? So my thought is that if you would like to be a nurse and enter this program, you should apply for the program. There is really, if you do apply for something else like biology or public health, there is no way to then change your application to nursing because of how impacted it is. So if you want to do nursing, you should apply for nursing. Now, if you aren't admitted to nursing like we talked about, you can still come to Cal State Fullerton. If you're offered admission to something like undeclared, you can switch that to public health, biology, chemistry, any other major that suits you. And then you can inquire more about our CSUF student pathway that I touched on a little bit. Our website, again, is going to have more information on that as well. And again, I see a question there. Can we take the prerequisites at Fullerton if we're not in the program? Yes, any student can come to Cal State Fullerton into any major and take the classes that they would like to take. So you can come in, let's say you came in as a dance major and you want to take human anatomy. You can do that. We offer all of the classes that you need in order to get into a nursing program at Cal State Fullerton. So yes, if you aren't admitted to the program, you can take your prerequisites at Cal State Fullerton before applying to other nursing programs. Okay, I see what other pathways we take to major in nursing. We talked about a couple of them today. The main goal of today is talk about that freshman program, but please know that you do have other options, especially the associate's degree in nursing. The best place to get a comprehensive list of all of the options you have for pre-licensure nursing in the state of California is the California Board of Registered Nursing website. So that is that rn.ca.gov website. They list not only the pass rates like we talked about earlier, but also every single program in California that offers nursing. So you can go onto there and see all of your options. I see some questions here about the interview, so I'll chat about that really quick. What will be asked during the interview, or what are we looking for in the interview? These are great questions, and I will give you my most honest answer, which is you. We are looking to get to know you. We obviously have seen your grades, your GPA, we have seen your essay, so we know you to an extent, but the interview is where we can see you face to face and hear your passion for nursing, hear what motivates you, just hear more about who you are. So I know students are always nervous for interviews, but I tell them there's really no need to be. We're not gonna make you do calculus or anything like that. That interview is really a get to know you, because nursing is such a unique career. You know, you need to be great at the sciences and smart in that aspect, but you also have to be kind, right? And wanting to work with people and help people. And so that's why we have this very unique admission process. Another question I see here is, what is the acceptance rate for students admitted to the program? You know, we do receive usually about 4,000, applications plus, and we do admit 40. I'm not great at math, but I know that's quite a low acceptance rate. And that, again, is just due to our limitations of how many students we can admit. I see some questions here. Do we take college classes that you've taken in high school? nursing doesn't change anything about regular kind of admission to Cal State Fullerton, if that makes sense. So yes, you can take college classes while you're still in high school, and we will still have them transfer over. Same with your AP, your IB, you will still get credit for all of those. That is not different for the nursing major. Okay. Let's see. If you aren't accepted and you're going to be undeclared, if so, what do you do if you still want to major in nursing? So that's that CSUF student pathway we talked about, as well as what I talked about more towards the beginning of applying to 10 plus nursing schools. Nursing is impacted, and we want you to be a nurse. You want you to be a nurse. And therefore, part of that is just applying at a lot of programs. 10 plus minimum programs. So if you're not admitted, please know that this is not the end of the road. We have a lot of people and a little amount of space, but there are options for you. I see a question, the essential factors to be considered for the program. Our website is going to list, we talked about some of them today with the letter of rec and the essay, all of that. Our website has more detailed information about that. So I encourage you to visit there. You can read exactly what we're looking for in your application. Okay. A question here about priority to local area applicants. Yes, there is a small part of priority given to local area applicants. It is very small, but we do consider local applicants being a Cal State. Question about extracurriculars. If you really want to highlight your extracurriculars, this could be done through a letter of recommendation. Maybe a coach or someone who has mentored you would be a great person to write a letter of recommendation, talk about maybe your leadership skills and your extracurricular activities. Or of course, depending on the essay question, which we want you to answer, if it can tie into your extracurriculars and you want to talk about it there, that could work as well. And I see a question about the LVN to BSN program. The difference between LVN and ADN. We are talking mostly today about our first year program, so I will type in an answer to this towards the end here. But today we're talking about our first year program. The LVN to BSN is for students who are already licensed vocational nurses. So one of my other nursing wonderful staff here can help answer that question. What are we looking for in potential students? Again, we are looking for what we ask for on that application. We're looking for someone who is passionate, who wants to be a nurse, who knows what the nursing role is. Like Dr. Behan talked about at the beginning of the presentation, there's a lot of differences between a PA, a nurse, a doctor. So we are looking for someone who is really interested in the nursing, the patient care. I see a question here about AP. We do not have a requirement of AP or IB or community college classes. That is not a requirement for nursing. They are considered, of course. Admission to Cal State Fullerton does consider your AP classes, but that is not a requirement to get into the nursing program. Another question, as a high school student, I am enrolled in concurrent enrollment at a community college. Are there prerequisite classes to take now to get ahead? That's a great question, a very specific question. And the short answer is no. Our nursing program is a cohort program, meaning all of our students move lockstep together. So there is not a way to go faster through the program than other students. So while concurrent enrollment is wonderful for getting ahead in college in general, it actually isn't necessarily a benefit in nursing because you still have to be here for the whole nursing program, which is a set 4 years. Okay. Feel like I answered some of the questions already. Can we send more than 2 letters recommendation? Go into the application. It will tell you everything you need to know. The short answer on that is no, only 2. A great question here by an anonymous attendee is, I know nursing school is going to be hard. What advice do you have not to give up? Kate, do you want to take this question?
I would actually like to take that question. And I will say that it is challenging. I like to say that it's challenging as opposed to hard, but it is hard, especially now as we're adapting with COVID. And so having that passion and understanding this is the path you want, that's one of the reasons why we sort of differentiated the different paths into healthcare is if you want to be a nurse and that is your dream, then it's a lot easier to overcome those challenges because you're working towards that goal. If you would like to be a medical doctor or a PA, then nursing is not the path for you. There's a path for PA and a path for a medical doctor. As far as the students that we currently have, there's a lot of resilience, a lot of flexibility, and you'll find that you will develop some really strong friendships with the rest of your cohort as you face similar challenges, both in the class and the clinical.
Wonderful, thank you. I'm typing in some answers here to some of the questions as well. A question here, do you have to do the nursing program in order to become a pediatrician? Just like Dr. Behan just mentioned, nursing is not the major or the career to go into if you want to be a doctor, a physician, or a physician's assistant. That it's apples to oranges. I know we think of it as they all work together, they all help people, they're all for, in the medical field, and they seem very similar, but they are very, very different. So it would be, similar to, I want to be an actress, and then I go to, ceramics school. It's both art, but it's very, very different. Okay. Are there any other questions? All right. Hopefully we answered them all. Again, I know we have limited time, but I do encourage you to go to our website. We have so much information there. Definitely take a deep dive, read through all of those FAQs. And then if you still have questions, please do email us. I am the advisor who's in that BSN at Fullerton account. So if you have questions on the freshman program, please do email me there. All of our other wonderful advisors are on our other nursing email account for any questions on our other programs, like the program we have with RCC, the program we have for LVNs. So we do have some other programs. Those questions should go to nursing@fullerton.edu.
Thank you so much. It's been such an honor learning. We always get so many questions about nursing. So thank you so much for your flexibility, your support, sharing your knowledge. Really, really appreciate it from our department. This has been recorded. We will be posting it on our YouTube website. So if you want to go back and refresh yourself on some of the questions that I was answered or some of the presentations, please go back to the YouTube page and check the YouTube video as well. But thank you so much, both of you, for being here. We really appreciate your support, your hard work. And thank you all for being here. Have a great day.
Thank you, everybody.
Thank you.
Bye.